Hi, and thanks for joining us for day 3 of Mitochondrial Disease Awareness Week. The patients sit at the core of everything we do. We meet with them frequently to understand their disease and their symptoms so that we can better design our therapeutics. Today, you're in for a treat. Daniela Gallo, mitochondrial disease patient and clinical trial coordinator, will join us. Thanks, Daniela.
Can you briefly introduce yourself and tell us a little bit about your connection to primary mitochondrial disease, MITO?
Of course, I'm Daniela and I'm 36 years old. I live in Switzerland, but I'm Uruguayan and Italian. I lived in both countries. And I have a mitochondrial disease that is called Kearns-Sayre syndrome.
And when did you learn that you have a mitochondrial disease, and how was it discovered?
So I learned about my mitochondrial disease when I was 31 years old, so almost 5 years ago.
Mm-hmm.
It was just by accident in a way, because I had some eye issues, an infection or something, and I went to the ophthalmological hospital that we have here. And at the end, I was just there to check my infection. And at the end of the visit, the doctor asked me to, just the test to follow the finger with your eyes. And I could tell there was something wrong because he kept on asking me to look at his finger. And I was like, I am looking at the finger. But he told me that I had no eye movement.
Okay.
And for how long I was not having eye movement. And I had absolutely no idea what he was talking about. But to be fair, my disease was diagnosed at 31, but I started having symptoms when I was 12 years old, more or less.
Mm-hmm.
I only had one droppy eyelid, and no one had an answer for that. After he saw that I did not have eye movement, he sent me to another ophthalmologist that was much more expert with rare conditions. And she was amazing because immediately after just checking my eyes and some control, she said, I really believe you have a mitochondrial disease. And we will need to do other checks for that. So I went to a neurologist. I saw the neuro-ophthalmologist at the hospital as well. I saw the mitochondrial disease expert and geneticist. And finally, they did a muscle biopsy that showed the red ragged fibers, which is a clear indication of mitochondrial diseases.
Oh, yeah.
And then they did the DNA testing, and it showed that I have a deletion in my mitochondrial DNA. So it was confirmed.
So it's really good with the genetic tests that they have it now.
Bless them, yes.
So you might have answered the question already, but how is it affecting your everyday life, and what disease expressions are most debilitating for you?
I deal with chronic fatigue, and it's something very present in my life. I almost need a nap daily just to kind of function. So that's one thing. And then in my case, besides the chronic fatigue, is a lot of eye symptoms and general muscular weakness, especially in my legs, in my arms, and in my neck. That's quite there. But I have learned to sense my energies and work kind of accordingly.
And how has the support from the healthcare been for you?
So now I have really a bunch of specialists, and they are constantly talking to each other and addressing each other. And even for issues that are not related to mito, they will go and ask my mito specialist first to see if this treatment or that treatment can work or not. So I feel very blessed in that sense, because the healthcare system is really helping me a lot.
Thank you, Daniela, for taking the time to answer our questions. And you can watch the full-length interview on our YouTube channel by clicking the link on your screen. See you soon.